know, my name is Dayana Amelia binti Saharudin. Throughout this course, I have explored various psychotherapy theories. After much reflection, I have chosen multimodal theory as my counseling theoretical orientation. This theory resonated with me because it recognizes the complexity of human experience and allows for a flexible, holistic approach to helping clients. So, before we start, let's get to know multimodal theory. So, what is multimodal theory? Multimodal therapy is a comprehensive and flexible approach developed by Dr. Arnold Lazarus. This theory is well documented in his foundational book, Multimodal Therapy, a basic text, as well as in Corey widely used textbook, Theory and Practice of Counseling and Psychotherapy. Multimodal therapy is based on the idea that people are complex and function in multiple interconnected ways. According to Lazarus, effective counseling should address not just one aspect of a person, but the full spectrum of their experience. He identified 7 key areas, summarized by the acronym BASIC ID. B. Behavior, what a person does, their habits and actions. A. Affect, their emotion and feelings. S. Sensation, physical sensations such as pain, tension, or relaxation. I. Imagery, the mental pictures or images they experience. C. Cognition, their thoughts, beliefs, and attitudes. I. Interpersonal relationship, how they interact with others. Last but not least, D. Drugs or biology, their physical health, including medication, diet, and lifestyle. Lazarus emphasized that no single counseling technique works for everyone. Instead, counselors should assess which of these 7 modalities are most relevant for each client and then tailor the intervention accordingly. For example, if a client is struggling with anxiety, I might use relaxation techniques for sensation, cognitive restructuring for cognition, and social skills training for interpersonal relationships. Corey also highlighted that multimodal therapy is an integrative approach, drawing techniques from various theories such as cognitive behavioral, humanistic, and psychodynamic, depending on the client's needs. This flexibility makes it highly adaptable to a diverse client and setting. In summary, multimodal therapy is a holistic, evidence-based approach that helps me address the unique and complex needs of each client by considering all aspects of their experience. This is why I find it to be a powerful and practical orientation for my future work as a counselor. Next, relevant techniques for each modality. Let's break it down like this. Let's say breathing. The example technique is behavioral modification. And the idea is build positive habit by providing reward. Then we can say, let's set a reward system for completing tasks. It goes the same as the other modalities such as effect, sensation, imagery, and many more. Now, to demonstrate, let's take an example of a case scenario. Imagine a university student named Sarah who is feeling anxious about exams. Using multimodal therapy, I would help her create a study schedule, teach her relaxation breathing, challenge her negative thoughts about failure, encourage her to talk to friends for support, and discussing the importance of sleep and nutrition. This way, I address her needs holistically, increasing the chance of positive change. As I reflect on my journey in this counseling course, I realize how much my own personality and life experiences have shaped my approach to helping others. I consider myself empathetic, open-minded, and genuinely curious about people's stories. I enjoy adapting to new situations and learning from diverse perspectives. These qualities naturally draw me to a counseling style that is both flexible and client-centered, which is why I choose multimodal theory as my orientation. My core values include respect for individuality, cultural sensitivity, and the belief that everyone has the potential for growth and change. I firmly believe that no single method works for everyone, and that effective counseling must consider the whole person, their thoughts, feelings, behaviors, relationships, and even their physical well-being. This belief is deeply rooted in my own life experiences. I have faced times of stress and uncertainty, and I noticed that my challenges were rarely limited to just one area of my life. For example, During periods of academic pressure, I realized it affected not only my performance but also my emotions, sleep, relationship, and even my self-image. This taught me that true healing and growth require a holistic approach which multimodal theory provides. My life philosophy is to meet people where they are and to walk alongside them as they discover their own strengths. I value creativity and adaptability, and I am always willing to learn new techniques if it means better serving my clients. I also believe in the importance of cultural awareness, especially in our diverse society, and I strive to be sensitive to each client, backgrounds, and unique needs. In summary, my personality, values, and experience have led me to choose multimodal theory because it allows me to integrate different techniques and tailor my approach to each individual. I am committed to continuous self-reflection and growth, both as a person and as a future counselor. I hope to work in a university counseling center. Students often struggle with academic stress, relationships, and mental health. Multimodal theory is perfect for this setting because it allows me to address a variety of issues, from anxiety and negative thinking to a sleep problem and social skill in a personalized way. In our multicultural society, people have diverse backgrounds and needs. Multimodal theory is adaptable. It respects individual differences and cultural values. For example, in collectivist cultures, I might focus more on interpersonal relationships, while in other contexts, I might emphasize personal coping skill or family involvement. This flexibility makes it effective and culturally sensitive. Last but not least, multimodal theory empowers me to help clients in a holistic, flexible way. It fits my value and my vision for counseling in our diverse, modern society. That's all for me. I am the Amelia binti Saharudin, and thank you for watching.